Well, good afternoon and welcome. And thank you for joining us today for the fourth and final Lunch and Learn, talking about the United Way CHAD pillars of education, income, and health. I'm Mark Feit. I'm the Lincoln Director of CHAD. And I want to welcome not only all of you who are watching today, especially if you've been to more than one of these to learn about our mission and our charities and the great work that we do, but a special welcome to our four panelists who are taking time out of their very busy days to join us over their lunch hour, and you will meet the four of them in just a moment. But first, a little bit more about the United Way and CHAD partnership. We are two separate organizations, but we have worked together in Lincoln to fund currently 62 charities. We've had a partnership that goes back decades and decades, and it is a fantastic partnership. We believe to do the most good, to help the most people that we can in our community. So United Way has 41 charities in Lincoln and Lancaster County, and CHAD has 21 charities, not only in Lincoln and Lancaster County, but statewide. CHAD stands for Combined Health Agencies Drive, and we deal with chronic health conditions and end-of-life issues, and we understand that those issues are the same whether you are in Beatrice or Benkelman or Benson or name your community in Nebraska that starts with B. Those issues are by and large the same. So that's why we, CHAD, as a charity, as an agency, as a federation, why we work statewide, and why all of our charities do as well. So that United Way CHAD partnership is really great in Lincoln. I work personally as an extension of the resource development team of United Way, and it's really a seamless partnership where we work together to raise the most money we can for our member charities. And we'll have plenty of time at the end of today for questions, but I think we should jump right in. So let's meet our panelists today. Joining us and panelists, if you would like, after I introduce you, feel free to unmute and say hello so they can see your face on the broadcast. So first, Sharon Stevens is the Executive Director of the Alzheimer's Association Nebraska chapter. Sharon.
Hello, everyone. Mark, thank you. I'm delighted to be here with my colleagues that I've worked with before. I look forward to telling a little bit more about our story, but also to answer any questions you might have.
Thank you very much, Sharon. Peggy Reicher is the Executive Director of the Brain Injury Alliance of Nebraska. Peggy.
Hey, thank you again. Yeah, I ditto Sharon's comments. Thanks for the opportunity to be able to talk to a broader group. So thank you.
Lacey Bolte is the Supportive Services Performance Manager for Nebraska AIDS Project and works out of the Lincoln office. Hello, Lacey.
Good afternoon, everyone. Also, thank you for having us. Super excited to hear what everyone else has to share today.
And last but not least, Heath Bodie is the President and CEO of the Nebraska Health Care Association and Nebraska Hospice and Palliative Care Association. Heath.
Mark, thanks for the invitation today. I, like the others, am excited for the conversation and the ability to just talk a little bit about what's been going on across our state. I look forward to it.
Well, again, thank you to the four of you for joining us today on this webinar. I'm excited to get into the meat of the questions and talk more about the great work that you're doing. And we have been talking about that this year in our campaigns across the community and across the county. So let's get into it and start asking questions. So our first question to our panelists: what opportunities have you seen in the programs that you currently run to better serve or to serve differently the people that are in those programs? So we will start with Peggy Reicher. Peggy.
Yeah, thank you. I think for us, so we're just a small nonprofit of a staff of 2.5. We have a statewide reach. So and most of our staff, we live in either Omaha or the Lincoln area. One thing that we've always talked about doing but never did was to get Zoom or be able to do some teleconferencing kind of opportunities. So we jumped on the Zoom bandwagon with everybody else and honestly found that to be one of the biggest gifts that came out of COVID for us. we've actually had a much easier time reaching our folks. We were able to use Zoom to do conferences, to do trainings, we've also used it to do some virtual support groups. We right now run 4 virtual support groups that we had never been able to do. So a lot of our population doesn't necessarily, individuals with brain injury maybe sometimes have a hard time driving or rely on others for transportation. They still need a little help sometimes with Zoom, but to be able to give those individuals the opportunity to be engaged in a support group and meet with others has just been really incredibly valuable. So, you know, when life gives you lemons, you make lemonade, and that's how we were able to kind of switch. And it's something we'll never go back from. I mean, we'll always have to make sure that we have that video capability so that we can reach more of our folks.
Excellent. Well, Lacey, I'm going to ask you the same question. What opportunities have you seen in your programs to better or differently serve your program participants?
Really good question, Mark. So at Nebraska AIDS Project, we have just under 30 staff, and we're also across the state. We have 5 different offices, and our biggest service is supportive services for people living with HIV through a medical case management program. And our case managers are just amazing, amazing people who have taken the unique opportunity of COVID to engage with clients differently. We're doing services over the phone, over email, using Zoom and technology. And we're able to engage folks who maybe never engaged before because of travel limitations or where they're located, or maybe their health. Maybe they were homebound, and so we're able to reach them in that way. So we've been able to continue to provide our case management services. And I think this will help us in the future. You know, if there's a snow day, that's not a barrier for us anymore. We can still help clients, even though maybe we can't drive to the office. We can use this for the future, and it's going to be a huge benefit to the folks we serve. Plus, there's just little yummy rewards that we get with this. Like the other day, I was doing a Zoom call with a client. We're trying to figure out some employer insurance, some really boring stuff. But he showed me his Thanksgiving decorations in his home, and it was just so wonderful. And normally I wouldn't get an opportunity like that. So I think that's really amazing opportunity for us. Nebraska AIDS Project also does HIV prevention. So that includes HIV testing and offering condoms, and we've been able to adapt those services as well. We're able to mail HIV tests directly to folks' homes, and they can administer those tests themselves. So we've been able to adapt our services at really reaching folks even better than we ever have before. So COVID's been really hard. I don't want to just gloss over it so beautifully, but we've really had really great opportunities and community support to continue to provide services.
So as a silver lining, you feel like you're able to serve more people than you were before?
Yeah, I think it comes and goes. Different types of people that maybe we couldn't reach before, I would say, for sure.
Great. Thank you, Lacey. Our next question, this leads perfectly into it. There are very few good things we can say about COVID. How have the people you serve been impacted by the challenges that we have all faced since middle of March, since COVID? Sharon, let's start with you on this one.
Well, thank you, Mark. Well, it's no secret that older adults are vulnerable, and especially those living with the disease, that the isolation has been devastating. And unfortunately, we can't quite see the end of what that's going to be. So we serve people living with Alzheimer's and other dementias, but we really serve the caregiver piece of that, the family and the caregiver. So what we're trying to do is to make sure that they have everything they need to navigate this, because this is uncharted territory for all of us. Many people have talked about not seeing their loved one for months. And people will often say, well, why don't you go do a window visit? Well, it doesn't work for everyone. And so our job is to pivot and put together what those caregivers need right now. And so we do that through education. We're doing that through our care consultations to make sure that we're relevant to them all the time, because this is new territory, and those living with the disease are at risk, a higher risk of death. We've seen a double-digit increase year over year for those living with Alzheimer's or other dementias who have passed. And it's our job to keep the hope alive. And so that's part of what we're doing.
Thank you, Sharon. Heath, I'm going to ask you the same question, and you and Sharon have some overlap in the people that you serve with caregivers and our elders. So we've learned a lot about COVID and its impact on older Americans. So Heath, talk about your constituents.
Yeah, thanks, Mark. And you're absolutely right. Sharon did a great job at pointing out one of the a bit of an unseen impacts to, in our case, elder Nebraskans, and whether it's Nebraskans at the end of their life or Nebraskans living in a congregate environment, or as Sharon would often tell you, she covers those and many others with her work. So the psychosocial well-being, the emotional well-being has been huge. And the interesting thing about this virus, and maybe we don't all realize that as just Joe and Jane Nebraskan, is how much we didn't know. How much we didn't know from the beginning, and then the impact of that as it's gone along, especially with congregate elder living. So people that might reside in a facility, whether that be an end-of-life facility, whether that be an assisted living facility or other senior living environments. And this idea that these team members, I think about, the heroics, if you will, and I don't think that's overstated, of these team members that have realized, I'm going to get up, have my cup of coffee or my soda. I'm going to suit up, if you will, if I use some sports analogies, and I'm going to go back in and face this invisible deadly monster again today. And I say they do that only because they have a heart to serve. Normal people, well, that's not fair, but many people wouldn't do that. Many people wouldn't go back in and face those things. And so when I think about the impact, it's completely changed the people that we represent, the providers world. It just completely changed it. It's not at all the same. And Sharon talked about the isolation and the emotional impact for elders. It's been huge. We were asked by the government very early to get away from, when we're talking about congregate settings, to get away from group activities where we can have, more than a couple people, maybe play a game together or sing along, or church, things like eating together. And I know we all did that. We stopped going to restaurants early, but we choose to get up and go to a restaurant when it's in the environment. Imagine if you had your family in your home and, 6 or 7 of you live in your home, and now you're not gonna be able to eat the dining room table together for, as Sharon pointed out, for months and months and months. It's just drastically changed the world. But I want to end, you pointed out, it's hard some days to find good in COVID. I do want to point out that I am so in so much appreciation for these team members and the way they've found to do whatever they can to get around those things. Sharon's right. Window visit is not like touching your loved one. It's not like hugging them. But there are great examples of people that have just tried to work around within some safe parameters. So to say it's affected our work, the associations for sure, but from our members' perspective, our association work went from, representing in things around policy and legislature to, we became PPE locators. We found bazillions of gallons of hand sanitizer and masks. Not even kidding, I'm smiling, but we literally changed to a go find it wherever you can get it perspective, so that the healthcare providers across this state can have it, because nobody had personal protective equipment. So it's definitely had an impact. Sorry, Mark, I probably went a little long, but it's definitely had an impact on the people that we serve, and of course on those elder Nebraskans.
Well, and I'm going to throw a little curveball in here, and any of you feel free to answer this, but we have heard and read the stories across our country and around the world of not being able to find enough healthcare workers to take care of the people who are sick. Are any of you dealing with that in your daily lives?
Well, certainly we are with the provider environments, all of healthcare. We don't represent hospitals' acute care, but I'm in a lot of conversations with them, and all across what they call the acute and the post-acute spectrum, whether you're talking end of life, assisted living, senior living, hospital settings, we're really struggling in Nebraska. It was already tough. COVID just put that on steroids.
Thank you. Peggy, let's talk about the same thing. How have people with brain injuries been impacted by COVID?
I think it depends upon who you ask, but within our general population of individuals with brain injury, I think a lot of them relate to what some of them have said. Now everybody knows what we go through. And that is primarily from the perspective of oftentimes they feel isolated. Their friends have left them. Because of their injury, they've maybe somehow changed personality or whatnot. And so therefore, family and friends will maybe just not be there for them like they used to prior to their injury. So in some ways, our folks were like, yeah, not being able to see friends or being able to connect with folks, that's kind of the world in which we live. And, the fact that they need to be isolated, they're like, we're already kind of isolated. So strangely, some of them are like, maybe people finally understand from where we're coming. So that's one way. But also, one of the things that I've been concerned from our constituents or from the individuals we're working with is sometimes they don't have access. So we talk about, getting tested. And within our population, some of our folks aren't able to drive. And I'm guessing this is similar to the elderly population too. It's like, go get tested, but you have to drive to the testing spot. You don't have somebody driving to you to help provide that service. So that's been a little bit of a challenge. Being able to, yes, we have access to it, but do we really have access to it? If you have a car and can drive, you have access to it. If you don't, then you don't. So that's been a little challenging in ways that I wish that we as a Nebraska community could be addressing that a little bit better.
It's a big state.
It is a big state.
All right, well, let's talk about stories. I love sharing stories, and it's one of the things I truly love about my job is that I get to talk about the people that our charities help every day. So, Lacey, why don't you share with us a story of someone or a family that you've helped in this pandemic that helped you, that made you smile?
Yeah, absolutely. I think of a fellow that we worked with. He's been working in assisted living facilities his whole career. He just loves working with people, and he happens to be living with HIV. And HIV can be chronic. It's a chronic disease that you manage, and you can live a normal, healthy lifestyle. But when everything with COVID shut down, he was terrified to go to work, and had to make that really hard decision. Do I continue doing this job that I love, or do I take some time off to protect my health? And what we found in the research is that if folks who are taking their medication, living with HIV, and going to their doctor's appointments and living healthy lifestyles, COVID has the same outcomes for them as somebody who's not living with HIV. And so he decided to stay at work, and he helped so many folks in his time, but sadly he did get COVID. And that happened recently here in October. And so he had to take some time off work to quarantine. And we are so blessed here in Lincoln. We have so many community agencies who are helping folks. So he was able to get assistance and maintain his housing, and maintain most of the things in his life. And all that NAP helped out with was we bought him some groceries that could get delivered to try and meet the gaps because he couldn't go to the grocery store. And that's all we had to do because the rest of the community wrapped around him in support. And I'm happy to report he's fully recovered. He's back at work. He's kicking butt. But I just wanted to share that story.
Thank you. And speaking of food and NAP, I tell people this a lot too, as a really an example of how so awesomely well our 62 charities work together, that you have a food pantry at Nebraska AIDS Project that is provided by the Food Bank of Lincoln.
Yeah, we partner with the food bank to supplement our food pantry so we can buy food for pennies on the dollar and stretch our nonprofit dollars a little bit further to help folks out. It's awesome.
I love collaboration. I'm a big fan. Sharon, share a story of someone you've helped.
Oh, I'd love to. Probably our highest impact, or one of them, is a care consultation. And we pivoted some because care consultations, just like Lacey explained, now can be by phone or video. A care consultation is handled by someone who's a master's prepared social worker, and their only goal is to help address the next step. What question do you have? They don't solve 5 years down the road. They literally solve what is next step. It is our most popular service. We do evaluation, and they just give it high marks. And so I was able to, in evaluation, pull out a transcript or an eval from someone with a zip code in greater Nebraska. And this call came in the middle of the night. And you think, well, why can't they just call during the day? No. So the care line is open 24/7, 365. And for those who understand and have been around people with Alzheimer's, sometimes the timing gets mixed up and they're awake. And so that caregiver, that question might bubble up, and just that person needs to talk to someone at 2:30 a.m. So this caregiver did that, made the call, talked through next steps. I'm struggling with isolation. I need all of it. All of our calls are more complex, every single one. Everything is heightened during this time. So her eval came back, and she was just delighted with what's not her life, but what is happening. And she wrote this: just one call made a difference. And so what I'm proud of is I want her to call back as many times as she wants to. But she's telling us that even just one call, even one conversation with a care consultant made a difference in how she was handling her loved one. So I want to do more calls. They're free. All of our, as others here, all of our services are free, and we want people to take advantage of them.
Chronic illness is so very isolating in a non-pandemic world, but when you are also isolated by a pandemic, the fact that you can reach out and call that number, 800-272-3900, I'll just put a plug in for you, is truly a lifesaver in this pandemic. And to all of you who are answering the phone, answering the emails, doing care consultations, to people who can't get, who can't go see the doctor, can't go see anyone, you're making a difference. So thank you. Let's talk about gaps. Peggy, what gaps are you seeing in the community you serve right now?
I think for the most part, we've seen, again, I mentioned it earlier, but just access to testing for some of our folks. And this isn't necessarily, well, this could be still kind of COVID related, but just having the opportunity for folks to recognize what is brain injury. That's just a chronic thing for us, but it seems like it's even, so for example, we've been trying to do some education about kids showing up with concussions in the classroom because sports are still going on, but it's really hard to even get people to want to pay attention to that because we're all talking about COVID, and not as we need to be. But at the same time, I think for us, a gap would be just how do we keep doing our job, what we're wanting people to learn about and understand when the whole world just kind of is taken over by COVID. And I don't know that one would clarify that or identify that as a gap, but that's one of our struggles as a nonprofit. And I'm guessing others are maybe dealing with that too, because if it's not directly related to COVID, you kind of have a hard time getting your message out as a nonprofit. So I'll leave it at that.
Thank you. All right, how about a scary question? Heath, what keeps you up at night?
That is kind of a scary question. I thought a little bit about this notion over the last weeks, and frankly, if I'm thinking about this real time, maybe even just as a Nebraska citizen my entire life, what scares me, what keeps me up at night right now is the data related to COVID. This idea that we're having conversations around what they call crisis standards of care, which in my own simpleton terms means rationing. It means when and if, or if maybe when isn't quite so certain, but it's looking like when is coming, that we run out of hospital beds as an example, who's going to get that bed? Is it somebody that our members serve at the end of their life, or maybe an elder that's 88, or is it the young person? And I get that, and that stuff happens. But man, does that, when I wake up at 2 a.m., that's a little spooky. I never thought in my life that we'd be talking about that, but that is where we are. You asked about team members earlier, or staffing, having enough workforce. And frankly, Mark, I got to tell you, it's another thing that keeps me up at night. Where are the people? We're 1.9 million people in Nebraska, which is not tiny, but it's not big. And when we see these struggles to get healthcare workers, and whether you're talking about in a hospice facility, in a clinic, in a hospital, everybody's struggling. And I just think, Jish, where are we going to get people to go, serve, to more people to go serve with their heart? And I know they're out there, and I know we can do it, but it definitely is a sort of keeping on top of mind. I think about the community spread notion. So I talked a little earlier about data, and one of the things that I've learned, and that we've learned especially when you're dealing with elders, when you're dealing with vulnerable, well, not just elders, but especially with vulnerable population, but especially elders, and especially in congregate environments. So again, whether we're talking about a hospice facility, whether we're talking about some sort of senior living facility, here's what we've learned. And this part's pretty scary. The behavior of the community around that facility. So we're talking about the facility that many people in that community, maybe we move away from Lincoln, and let's go to a town I lived in years ago, to Trenton, Nebraska, just a small little town in southwest Nebraska. Everybody in the town cares about the facility. It's a senior living facility. And the behavior of the people in those towns, not just Trenton, every town, completely affects the ability of those congregate environments to keep the virus out. So by that, I mean, are they willing to wear a mask? Are they willing to social distance? Or said differently, are we willing to wear a mask? Are we willing to social distance? Are we willing to not have congregate, get our groups together, our big parties or those sorts of things? Or we got Thanksgiving coming next week. Are we willing to forego having people so that we can stop the spread of this virus? And frankly, Mark, this has concerned us here at our work so much. We're starting a campaign tomorrow on social media called Why I Mask. Not because, I mean, honestly, I'm not a political, I don't think this virus and this masking stuff's political. It's just not to me. To me, it's about saving others, giving to more than myself, right? So this idea is why I mask. Can we lift up the elders, kids, loved ones, friends that, so anyway, this mask thing, this community behavior thing probably weighs more on me than anything else. And this idea that we have to realize as Nebraskans that our actions aren't just for ourselves. They just aren't.
Thank you. Sharon, same question. What keeps you up at night?
Well, thank you, Heath. I loved that. I have two things, and actually there's probably 100 things, but I'm going to talk about two. Part of Alzheimer's and other dementias is that the number of people who are diagnosed is growing. So as our population ages, that incline is going this way. So to me, as a leader in this field, it's understanding that growth curve, what's happening now, and what needs to happen to be of service to the growing number of people with the disease. It's kind of it's a puzzle piece, but we have to be aware that the number of people being diagnosed is growing, and that number doesn't change with COVID or anything else. So keeping an eye on that. And if it's okay that I take a switch from kind of programming, because we all raise money and that's part of our business. And for many of us, we've done it for years. I think people still want to give. We've really been quite blessed during this time. However, I think fundraising is going to change. I think how we do it, in the manners in which we ask, who we're asking, how we're asking. I just think the whole fundraising picture will change. And I, like everyone else on this call, I want to be on the front of that. I want to be smart about it. I don't want to be naive about it. I really want, because as I said earlier, answering my other question, our services are free because we fundraise. So I want to be able to make sure that we solidify that. And we live in an incredibly generous state. I mean, it's mind-boggling to me the way people support charities. And I just feel so blessed to be there. I do think we have to keep talking about what it looks like in the future.
Well, and I'm driving the bus. I'm gonna take a left turn here and skip around a little bit because I can't. I think it works perfectly. And apropos to that statement you just made, Sharon, we did have a question come in that says, "What does the future look like for the annual events you hold, walks, galas, et cetera, that provide so much of your funding?" And this is a free for all, so whoever wants to answer first, we can, as many of you can answer as would like to.
Why don't I go back in? I think we have a Walk to End Alzheimer's is our signature event, and all of our walks took place in the sense that we had people walk in their neighborhoods. We didn't quite want to say, well, that's all virtual, because that really isn't the truth. We asked that teams and families walk in neighborhoods, and we have amazing pictures of people all over state who participated in walk in their own environment. We didn't raise as much money this year, but I personally believe we raised more than maybe even I thought we were going to. But this is the point. I think that there are events are going to be part of our revenue. I think there are other foundations and grantors that want to help us. I think there are ticketed events that want to help us. I love to work in major and planned giving because those people want to give a legacy gift. So I think it's a combination of all of those. I can't, to be authentic, our revenue was down this year. But that's part of our planning for what next year is going to be. Our hope is next year we're live with our events. But if not, then we're going to do some kind of a blend, if you will, between something that might be in person and something that might have a virtual component.
Thank you. Anyone else have a follow-up or an answer to the same question?
Mark, our fundraising is a little bit different than what Sharon described, just in the way that it's done. But I think I would absolutely agree, at least from our perspective, that from here forward, maybe one of the good things we take from this crazy, however many months this is going to be, is that we'll probably always have a component of virtual and in-person, even when it's safe to get back together in person. I think that's definitely something we've learned. And I just want to emphasize one more thing that Sharon said. Nebraskans are incredibly generous. It blows me away.
Great, thank you. All right, skipping back around, and as I suppose a follow-up to the previous question, which was kind of the nightmare scenario. What, on the plus side, what gives you hope? And Lacey, let's ask you this question. What gives you hope?
I kind of mentioned it earlier, but I have been just so incredibly impressed with the resiliency of the clients we serve and the nonprofits in our community. Clients navigate hurdles and barriers on top of, maybe living in poverty, dealing with a chronic health condition. And nonprofits have all adapted quickly to continue to provide services for those folks. And they shared their tips along the way. We've learned so much from just our colleagues across the table. And there's tons of funding in our community right now, helping struggling families, making sure that they're not getting evicted. We've had tons of collaboration, like Legal Aid assisted one of our clients recently with a recent eviction. I've just been brought so much hope from our nonprofit partners.
Heath, same question to you. What gives you hope?
Well, the simple answer is people. People give me hope. Technically, I'm pretty hope-filled about the vaccine news that we're getting. I think that's a key piece of our ability, in the work that we're doing here, and frankly, all of my colleagues on this connection today. The vaccine's not a silver bullet, but it's definitely a piece of the formula to move us forward. I'm also very hope-filled about the team members. Again, maybe I'm sounding a bit broken in record-esque form here today, but I just think about what that's like to get back up and go face this thing when you can't even see it. You don't even know where it's at. So that gives me a ton of hope. And I know Nebraskans have big hearts. And then frankly, I'm a Nebraskan my entire life. I've been in all parts of this state throughout my career. And I think about, I just raised up that our behavior as individual Nebraskans definitely affects other people, especially vulnerable people, as we talk about mask wearing, social distancing, and those things. But that part gives me hope as well. It keeps me up at night because it's not, You know, the numbers could be a lot better than they are, but it gives me hope, because here's what I know about Nebraskans. We're tough. We've got grit. And when we're faced with big challenges, we buckle down and get it done. We get it right. And that's what I think is going to come from this, when we can help other Nebraska communities realize that that this behavior thing, this wear the mask theory can absolutely affect so many other people. I think they're going to do the right thing, and that gives me hope.
Excellent. Thank you. Well, we do have a couple more questions that have come in from the audience, and to those of you watching the webinar, if you do have questions, just pop those in the Q&A box. We'd be happy to ask those of our panelists. But one thing I really should have done when I introduced each of you is to have you talk a little bit about your charity and the things you do to help people. And so one of the questions kind of leads into that: how big or small is your staff across the state? So I'll give you each, because we have plenty of time, I'll give you each some time to introduce your charity, as it were, and talk about those staff teams. So let's go with Lacey first.
Sure. Nebraska AIDS Project has a little under 30 staff members. We're across the state, so we have 5 different offices. Our largest office is located in Omaha. I am here in our Lincoln office. We also have an office in Norfolk and Kearney, and all the way out to Scottsbluff. So we have staff members all across the state to serve clients. So we work with people who are living with HIV and providing them whatever sort of support they need. Maybe that's helping them navigate insurance, because that's a big nightmare. Maybe it's getting into care with the doctor and making sure that they're taking their medications. Our case managers use a medical case management model and a harm reduction model to try and meet folks where they're at. We also have HIV prevention and education services. So we provide HIV testing along with other STI testing and education in the community. And we've had to be really creative as how can we stay connected with the community and provide education. And luckily we have Facebook and social media for that, as well as Zoom panel discussions like this. We've been able to adapt testing into a testing to go model, so folks can get tests mailed to them for free and administer their test and know their HIV test results at their home. We also provide PrEP medication. So PrEP is a medication that can prevent HIV transmission for somebody who is HIV negative. And so we've been able to administer that program via telehealth. So that's a little bit about Nebraska AIDS Project.
Thank you. Sharon.
So we have 9 employees across the state, but what I'd really want to say is we really are volunteer powered. We have I believe, some of the best staff members, experienced, compassionate, skilled, but we really are successful because of literally hundreds of volunteers. So our volunteer ranks, they are facilitators for community education. They facilitate support groups. They are advocates or advocacy volunteers, communications volunteers, those willing to help tell the story in the media. So, and we do that across the state. One of the things that I think is a silver lining, because I'm going to jump back to a question, we accelerated some of the things that we were working on. So we knew we needed a better presence through community education that could be done by a webinar. We also knew that we needed more community education in Spanish. And instead of making that a 2-year, let's think about it, what do you think? We did it. During COVID, we said, we're going to figure this out. This is a need. So I think the silver lining, and this is again, the power of the volunteers. Volunteers who can do community education in Spanish. We found them and they're effective with our constituents who need that. So our pillars: research, education, advocacy, and services. We do not have a cure for Alzheimer's. And so if I were to have an underline: research, education, advocacy, and services, we need a first survivor. And that's what we're working for.
Thank you. Powerful. Peggy, you said it earlier, 2.5 staff.
Yeah, 2.5. And we work from our homes. We don't have offices. We have home offices. So that was an easy transition for us with COVID. But really our pillars are, we're trying to increase brain injury awareness through prevention, advocacy, education, and support. And we know that brain injury can happen to anyone, anytime, anywhere. It doesn't have to be when you're elderly. It doesn't have to be when you're young. I mean, you can be all ages and incur an injury. What we find is that through education, we're trying to find there are certain populations that are at higher risk for brain injury. We're finding those within homeless, corrections, juvenile justice, and also mental health. I think a lot of folks feel like, oh, it's a mental health issue. It's like, no, really, they've been hurt. Domestic violence. Those populations are running anywhere from 50 to 70% of them have had the opportunity for a brain injury, compared to the general population, which is about 8.5%. So we're trying to really reach out to those agencies that are working with high-risk individuals and trying to educate them about what is brain injury. So that's a lot of the work that I do. And then the other component, our other full-time person, is Chris Stewart, and she does our what we call resource facilitation. So once we've identified somebody's had a brain injury, it's very similar to case management. What can we do to help you figure out what are the services and supports that are available in your community? And if you don't have those services and supports, what can we do to help create them? How can we make, whether it's your neighbor, your boss, your teacher, understand more about how you are needing things different because you have a hard time with remembering or you have a hard time with focusing. We often try to educate people, is it a won't or a can't? Are these individuals after brain injury, are they simply choosing to be lazy, obstinate, or is it just that they've been hit enough times that it's really challenging for them to be able to do what you expect them to do? So a lot of education. And we are always hoping that we can grow our staff. We did get a trust fund passed in 2019, which hopefully will get started for us here in 2021 finally, to help expand our services. But right now that's kind of where we're at. So again, recognizing brain injury can happen to anyone, anytime, anywhere. So we're trying to do a lot with a little, but we're hoping we can grow.
Wonderful. All right, Heath, talk about your team and your work.
Yeah, thanks, Mark. Well, the work that we do with Chad is through the Nebraska Hospice and Palliative Care Association. So we get the opportunity to work with nearly all of the 38 licensed hospices in the state and many of the palliative care programs. And from a staff perspective, we're a little different. So I would say if it's like a hard number, we're probably 2.5 to 3 people, but we have the blessing to work with a larger health association family. And so really for us, it's more about having other team members with talents. And so really, we get the benefits of passion and talent from a lot of different people. Frankly, there's 16 of us here that do multiple associations. So the great part of that is we get some real synergy of passion, talent, and economies of scale, if you will. Our work is probably much like many of the others, try to raise awareness with end-of-life care and people with terminal illness. Offering educational opportunities, trying to have some policy work as it would come up, whether that be at the legislature or at HHS. Sometimes there's a funding thing or two that we work on related to the agencies, but always trying to lift up how to help Nebraskans have a positive experience at the end of their life. There's a strong component of veterans in there. And then, of course, trying to support caregivers, as I was talking about earlier, making sure they have the education they need, making sure they're advancing in the way that they feel is meaningful so that we can have just really great team members across this whole state. And Mark, if I could just take one more small commercial, because I'm sure everybody would love to say this. Honestly, our work, I don't even know what our work would look like at NHPCA, Nebraska Hospice and Palliative Care, if it wasn't for the support of Chad and the United Way. I mean, honestly, it would be, you guys are such a significant piece of helping us serve in the way that we're able to serve. I want to just make sure I say thank you.
Well, you're welcome. Thanks for being here today. Well, okay, we have a couple more the questions that came in on the Q&A, and we touched on part of these before, but I want to give you all an opportunity to talk more about it or answer it if you didn't. Has the pandemic caused you to see more or less need in the community?
I'll take let me see. It's different. And what we're finding is that some of the calls for our care consultations and other work that we're doing with our constituents, it's more complex. So people are waiting longer. So perhaps in a call, if they're diagnosed, the family's trying to figure some things out for whatever reason, they're holding out and calling a little bit later. We're still serving the same number, it's just different. And that's part of what I think we were forced in the best way possible to pivot to meet their needs, because those needs are more complex. He said it so beautifully, but just trying to figure out all the dynamics of this, all the moving pieces. So I think it's probably close to the same, maybe a little bit more, just different.
I think for us here at the Brain Injury Alliance, one of the things we've been really doing is looking with our national partners to see how much COVID has impacted people neurologically. We actually had our very first phone call for resource facilitation from a COVID patient who was in Northeast Nebraska, who got dismissed from the hospital, but was having some major cognitive difficulties because of what he'd been through. I think in my world, it's like, oh, this is a respiratory thing, but no, it's really affecting folks neurologically. And in our world, where we look at more than just traumatic brain injury, which is a bump or blow, the jolt to the head, but any sort of injury to one's brain after they've been born is a brain injury. And so when COVID is beginning to affect a person's neurological abilities, we're almost anticipating, if people know about us, that they can call us and we can hopefully help get them hooked up to the right resources and services. But again, at a national level, it's not talked about to that degree, but I think there will be, if people begin to connect the dots, I think there's going to be a greater need for our type of services down the road. And there are now, but again, we're just trying to get that messaging out there.
You know, Mark, the part that sticks out listening to Peggy and Sharon, they said it really well. The part that I really grabbed onto there was this connecting to things that weren't what we typically connected people to. And I think about, in our case, PPE, testing, hopefully very, very soon, vaccine. That honestly, I think in somebody's funny world, I'm going to get some sort of an epidemiology degree after this is all over. Never thought I'd know this much about a virus. Never thought I'd know this much about the differences in personal protective equipment. And that's not a complaint. That's just a reflection that probably when we went into 2020 thinking we had this glide path, that we really had this year rocking, that never expected that I like Sharon's term, have to pivot into things that we'd never done before. But that's good for us too. I think, Sharon, I think you said that. It's been very good for us to learn that we can pivot and serve in a way that's not what we expected to serve, but can still be highly meaningful to membership, to Nebraskans in the end.
And I would just add, I totally agree with it's not necessarily more, it's different. We're used to folks, because we serve across the state, dealing with rural isolation, but now folks are dealing with social isolation. And what does that do to your mental health? And how can we be supportive in these times? And I think the other thing, when you have a chronic health condition, you might have some other comorbidities that are going on. And for a long time, our systems were shut down, that they couldn't access those services, or maybe even when things are open, they're scared to utilize those. So dental health, eye care health, their primary care health, all those things are being put by the side because they don't want to leave their homes because they're worried they're going to get COVID, or maybe their doctor's not even going to see them right now. So those are things that I'm really worried about.
Thank you. Our last question, unless we get another one coming in, is something that many of you already did touch on as well. Has being virtual made it easier or harder to serve clients?
Well, I'll start on this one. I don't know if it's the actual service to the Nebraskan, but let me just talk about real quick about the word harder and virtual. It's one thing to have Zoom connections. We do a lot of that, like everybody on this connection today. We do a lot of that. And all of you that have joined us today to spend your time with us, you do it too. we did our first virtual like convention sort of thing. And I won't lie, it was a little spooky. That kept me up at night for multiple weeks going into it. I think about, is it making it easier or harder? And I alluded to earlier, for us, it's been better because it will always have a component with us from here going forward. When I think all of us serve this entire state. And so you think about, geez, we're in Lincoln, we got to serve Crawford. That's pretty rough to ask somebody to Crawford to come to us, or them to go, or us to go to them. Wow, is this virtual really impactful from a service perspective to be able to connect quickly? And I know you guys alluded to that earlier in some of your stories. So for us, it was harder to get there, a little scary, but better in the end because it will always have a component in the work we're doing.
I think virtual opportunities have been good and bad for folks who are comfortable using technology and have access to it. It's been awesome. We can speed up services. We can reach them when they're not in town. That's been awesome. But for the folks who are experiencing homelessness, who have never used a smartphone before, who do not feel comfortable, is my video safe right now? Can other people see this video? Then it's not a good use of serving them. So I think it's been a mixed bag. It really depends on the person.
And I think we also find, dependent upon what part of the state you're in and what kind of bandwidth you have. I mean, there's just some parts of the state that just have really not great connections. And so those folks end up not being able to join via video, but have to just call in and then miss part of what's maybe being, shared on a screen or whatnot. So I think there's that component that, I long for the day that we can actually have better bandwidth in outstate Nebraska. And I say that as somebody living in Lincoln, but if I go to my parents' home in St. Paul, Nebraska, I know it's like that internet connection just stinks and I may not get on. So I recognize that it's better in some spots than others. And it is what it is at this point, but hopefully it'll improve.
Mark, I would say that my colleagues are 100% on point. We share this. Everything that they said, we're all dealing with it in different ways. So.
Well, and as a follow-up to something that Lacey said earlier, and Peggy, you touched on this as well, intentionally or not, I mentioned earlier that chronic illness is really isolating, but it's also really expensive. It is really difficult to manage a chronic illness and purchase the things you need to live, especially if you are living, without a good, well-paying job. So, and that's something that we deal with all the time, even though, again, we're not in a pandemic. So if anyone wants to talk about the connection of poverty and chronic illness, we talk about that a lot at United Way campaign meetings because people don't understand that there is a cost to living with a chronic illness. It's not just get your pills and manage your disease. Don't all jump at once.
Well, goodness, I can talk about HIV a little bit. So HIV medications cost about $3,000 a month. And that's a life-saving necessary medication just to stay alive. So we're really lucky in Nebraska. We have a program called the Ryan White program, which can help folks who are lower economically to access medications and access insurance. But we're super lucky in Nebraska that Medicaid expanded as well. So many of our clients are reaping the benefits of that resource as well. So that's just another challenge that we continue, all of us have to deal with, all of my colleagues as well.
And Sharon and Heath, I know you both live in the world of facility care, and that is skilled nursing care is incredibly expensive. And I used to hear horror stories of years ago of couples that had to divorce after 50 years of marriage because one of them had Alzheimer's, and in order to not have to lose their home, they had to get a divorce at the end of their life.
Yeah, I mean, Mark, you're right on. It is, from a financial perspective, it's a scary thought, even when you plan well, right? Even when you've laid out these, I don't know, good approaches to what the later years of your life are going to look like. Jish, you get a curveball now and then. One of those can be the need for skilled nursing care, or even just other sorts of higher acuity healthcare. And you're absolutely right. It's a sad day when, from a poverty or the need to use state assistance perspective, causes, to your point, the impoverishment clause, which is the divorce, so that you can split assets and not deplete everything. And you know, I guess it's a bit of a keep you up at night thing in the end. The part that gets a little scary for me is I don't know how we bend that curve. I don't know how we take something that's so darned expensive now and change it and just say, well, you know, in 2022, this is going to be cheap. We're going to do this well. I just don't know how that works. And I know there are efficiencies, and maybe that's part of this. Maybe this is a bend over time with efficiencies, but staffing continues to get more expensive. Prescriptions continue to get more expensive. You know, I don't want to leave this on doom and gloom, but it's a kind of a tough scenario, isn't it?
I think for some of our folks also, again, injury can happen to anyone, anytime, any age. And, you know, the median age that we serve is 43. And if you have a brain injury at that age and you're in the prime of your life of making money and now you can't go back to work and you don't belong, no offense, Heath, but they don't belong in your facility. You want them to be home. And how can you, provide the wraparound service and supports that an individual needs when they're kind of in the prime of their life, needing to make money or whatnot? And I know that's where we often see families kind of fall apart. And I do believe that's why we see a larger number of people with brain injury in homeless shelters and domestic violence situations and corrections, because all of a sudden that all falls apart and it's kind of crumbled. And so, do we have the services that can support those individuals in the right way, in the right time, and at the right level? And I think we have some work to do in that area in our state.
Thank you, Peggy. Thank you all. We have, as I knew we would, had an amazing hour full of great conversation. And I, again, thank the four of you for your time here today and agreeing to be panelists. I also want to say thank you to Mia Wilkin at United Way, who's been running the show and put all this together and really did all the hard work to make not just this webinar, but the other three happen as well. So again, to the four of you, thank you for being on with us today. And to all of you watching, we also say thanks for you taking time to join us today and learn more about the work that the CHAD charities do. Thanks. Have a great day.